Have you ever had a family member suffer through a terminal illness? A few years ago, my stepmother passed away from terminal cancer. If she had the choice, would she have ended her life rather than suffering through months of agonizing pain? Of course. Assisted suicide is a very controversial topic currently in society. In fact, it is only legal in 9 out of 50 states. Assisted suicide should be legal in all 50 states because the terminal illness can take a very long time to cause a patient to pass away. Costs for medical treatment is high, and families are able to better cope with the idea of a family member passing away. Oftentimes, terminal illnesses can take months or even years for a patient to pass away. During this time, people dealing with terminal illness suffer from emotional and physical pain. Death with dignity laws are laws that are in place which allow a person suffering from a terminal illness to medically end their life. As stated from deathwithdignity.org, death with dignity statutes allow mentally competent adult state residents who have a terminal illness with a confirmed prognosis of having 6 or fewer months to live to voluntarily request and receive a prescription medication to hasten their inevitable imminent death. The death with dignity laws allow patients to avoid suffering by letting them choose when to end their life. Allowing the patient to end their life is more humane than constant pain and suffering that a terminal illness brings. Although there are medications that can help ease the process of a terminal illness, the patient is going to pass away regardless. Most patients who know that they are going to die would prefer to end their life in a safe way on their own terms. This allows for the death process to be more comforting. The cost of healthcare in America is outrageously high and causes many people who seek medical treatment to go into debt. Patients who suffer from terminal illness are very likely to put themselves into debt from the medical treatment that they need to receive up until the time that they pass away. According to the New England Journal of Medicine, when comparing the costs of basic medical treatment to end-of-life care, many commentators note that 27 to 30% of the Medicare budget is spent on the 5% of Medicare patients who die each year. Almost 1/3 of Medicare is spent on patients who end up passing away even after they have received large amounts of medical treatment. They also state, when looking at the last few weeks of life, they note that the expenditures increase exponentially as death approaches, so that the last month of life accounts for 30 to 40% of the medical care expenditures in the last year of life. If a patient were to decide to medically end their life, they would save thousands of dollars rather than spending that money for medical treatment that is not going to prevent death. When a patient passes away, the people that are most affected by the death is the family. With a terminal illness, it is difficult to tell exactly when a patient is going to pass away. If a patient were to choose the option of medically ending their life, the patient's family would have time to accept and prepare for the death of their loved one. Watching a loved one suffer and experience the pain of a terminal illness can be very difficult on the family. It is excruciating for the family to watch their loved one physically and mentally deteriorate. With assisted suicide, the family would not have to watch their loved one suffer and be miserable in their last few months of life. Not only does assisted suicide help spare the family of watching a gruesome death, it also allows them to feel as if they were involved in the death of their loved one. The family of the patient is able to help the patient decide if, when, and how they want to end their life. This gives both the family and the patient comfort by allowing the family to be involved in the end of their loved one's life. In conclusion, assisted suicide should be legal due to the effects of terminal illness, costs of medical treatment, and the feelings of the family. Assisted suicide relieves the effects of excruciating pain caused by terminal illness, relieves the patient from going into medical debt, and eliminates some of the grief that families experience during the time of death. Like my stepmother, many terminal illness patients suffer or continue to suffer from terminal illness. Medically assisted suicide is a painless way of allowing people to end their life to avoid the effects of terminal illness. If you or a family member is experiencing the effects of a terminal illness, consider the effects of medically assisted suicide.